Hey, future RN. Let's talk about one of the most important, and I mean most tested medication classes on the NCLEX, opioids. You're going to see questions on pain management, respiratory depression, and for sure, naloxone. So today, we're going to cover all of it, the different types, those key side effects, the antidote, and the patient teaching you absolutely have to know so you can walk into your exam feeling totally confident. Welcome to ClearPath NCLEX, your go-to spot for high-yield content that helps you pass on the very first try.
And I'm not kidding when I say this, you are pretty much guaranteed to see questions on opioids. So mastering this topic isn't just about getting a passing score. It's really about learning how to keep your future patients safe. So let's make sure you're ready for it. You've totally got this.
Okay, let's dive right in. Before we can even talk about side effects or what to monitor, you've got to understand what opioids are actually doing inside the body. So the two most important words on this slide are CNS depressants. Yes, they are incredible pain relievers, but they achieve that by slowing everything down. And honestly, that one single concept is the foundation for everything else we're about to talk about. If you remember just one thing from this entire review, please make it this right here. Opioids make everything in the body go low and slow. This little phrase is going to be your golden ticket to answering almost any NCLEX question about their effects. So let's break down what that actually looks like.
So think about it. The heart rate goes down, right? That can cause bradycardia. The respiratory rate goes down, and that's our number one biggest concern. Blood pressure drops, which can lead to hypotension. And of course, the brain slows down, which is what causes all that sedation and drowsiness. See, it all comes back to low and slow. It's all connected to that central nervous system depression.
Now, let's go over some of the main players. You really need to be able to recognize these common drug names on your exam so that you can immediately link them back to our low and slow rule.
Okay, so you're going to see names like morphine, hydromorphone, codeine, and oxycodone. Here's a great little memory trick for you. A lot of them end in "-one". So if your patient's vitals get too low and slow, what do? You phone the doctor. Now, fentanyl is kind of the big exception to that rule, but it's one of the most potent, so you definitely need to have that one memorized. All right, this section is where your critical thinking as a nurse is going to shine. Recognizing the side effects and knowing exactly what to assess is your absolute number one priority for keeping your patients safe. And look at that, all the major side effects link right back to our low and slow rule. But the number one most life-threatening side effect, the one the NCLEX loves to ask about, is respiratory depression. And here's a huge pro tip. Severe sedation is often the first warning sign that respiratory depression is coming. You also have to watch for that drop in blood pressure and teach patients to change positions slowly to prevent falls. And since the GI tract also slows way down, constipation is a massive issue you'll need to help your patient manage. Okay, I want you to burn this number into your brain, 12. If your patient's respiratory rate drops below 12 breaths per minute, you hold that opioid dose and you call the provider. This is a massive safety point and a classic NCLEX question. Do not give the medication. So what do you do if your patient's respiratory rate does drop dangerously low? Well, you need to be ready to administer the antidote. Let's talk about naloxone, which you probably know as Narcan. Naloxone is literally a lifesaver. It works by swooping in and knocking the opioid molecules right off those receptors in the brain. It basically reverses all of those low and slow effects. It's an opioid antagonist. Now, the most crucial point here, and the one the NCLEX will try to trick you on, is reassessment. Naloxone wears off pretty quickly, usually in about 60 minutes or less, which is often faster than the opioid itself. This means you absolutely have to reassess your patient frequently, and you need to be prepared to give a second dose if they start to become too sedated all over again. Your job isn't done once the patient is stable in the hospital. Educating them on how to stay safe once they get home is a really critical part of our nursing responsibilities. So these are your key teaching points. You're going to teach them to change positions slowly to prevent falls from that orthostatic hypotension. You'll encourage lots of fluids and fiber to prevent constipation. And this is critical. They need to know absolutely no alcohol and no driving, because both of those would just compound the CNS depression. And finally, make sure they know to report any extreme drowsiness or any difficulty breathing right away. All right. You have learned the core concepts, so now let's put that knowledge to the test with a few NCLEX-style questions and see if you're ready. Let's do this.
First question up, what is the most serious adverse effect of morphine administration? I'll give you a second to think about it.
Yes!
It's respiratory depression. It is always the priority because it directly threatens the ABCs: airway, breathing, and circulation.
Okay, next one. A patient receiving morphine has a respiratory rate of 8 breaths per minute. What is your priority action as the nurse? Think it through.
The right answer is to prepare to administer naloxone. A respiratory rate of 8 is a critical finding. It's well below that magic number of 12, and it requires immediate reversal.
And the final question, what is the antidote for an opioid overdose? You should definitely know this one by now.
Exactly. It's naloxone, brand name Narcan. It's the opioid antagonist we use to reverse an overdose. Fantastic job.
So let's just quickly recap the absolute key takeaways. Remember, opioids mean low and slow vitals. The most dangerous side effect is always respiratory depression, and you always hold the dose if that respiratory rate is less than 12. The antidote is naloxone. If you can master these points, you are going to crush these questions on the NCLEX. Thanks so much for watching ClearPath NCLEX. If this was helpful for you, please give it a like and subscribe for more high-yield content. And don't forget to hit that notification bell so you never miss our next tip. Drop a comment below and let me know which opioid side effect you always remember. You are doing amazing. Keep up the hard work. You've got this. I'll see you next time.